cases of which were found during an inspection of sewage works in East London. Health officials are concerned about it spreading, and they've urged everyone to check their vaccine status. Joining me now is Dr. Bharat Pankhania, who is, of course, well known to LBC listeners, senior clinical lecturer at the University of Exeter Medical School. First of all, Bharat, should people be concerned about this or not?
People who have not had their polio vaccines ought to be a little bit careful and make sure that they get immunized. However, by and large, and what I mean by and large, I expect 90, 95, 98% of our people will have had their polio vaccine, because that's something we give as a little baby. And what we have detected in the sewage is an indicator that someone somewhere has had the oral polio vaccine and is now being detected in the sewage. And that oral polio vaccine that they've had has most probably been given to them abroad. We don't use the oral polio vaccine in the UK.
OK, so is it prevalent in other parts of the world?
Polio has almost been eradicated. There are small pockets at the Afghanistan-Pakistan border where we still have persistence of polio, but by and large, polio has been eradicated. We've also had sporadic cases, unfortunately, in the Yemen, where there has been that prolonged fighting for many, many years.
Without being too indelicate, it was discovered in sewage. Is this a regular thing that sewage is checked for viruses and bacteria?
Yes, it is. And this is an example of something being picked up in the sewage and then an alert. And the alert is basically this. If a patient presents to you, doctors or clinicians, with flaccid paralysis, then do wonder if it could be polio. Highly unlikely, because the UK population is invariably, usually immunized against polio. And
symptoms, Bharat?
Well, it's flaccid paralysis. In other words, inability to move their limbs. Most people, it's a motor thing. So it's this limbs and arms. But most people will go on to make a full recovery. There are, we know about in the 1950s, they used to have the iron lung, where there was that paralysis and people couldn't breathe properly. And then it led to deformities, and you get people with funny gaits because of previous polio infection.
While you're on, let me talk about two other illnesses. One, monkeypox. What's the latest on that, Bharat?
We've got a rising number of cases, and I think it's reaching nearly 500 now. Again, mostly confined to men who have sex with men community, bisexuals. But we need to not see this as an issue with men who have sex with men or bisexual community. It is communicable to anyone. And ideally, if you are a contact, are a case, you shouldn't be out in circulation.
And what about the latest on COVID? My sister had it last week. It's not going away, is it?
Unfortunately not. And it is those variants of Omicron, BA4 and BA5, that are now spreading in Europe, United States and the UK. And unfortunately, case numbers are going up. I think come autumn, it may come to pass that we have a reformulated vaccine covering the variants, because the original vaccines have long past what was circulating in the community at that time.
Right, so we'll all get jabbed again. Thanks for your expertise, as always, Bharat. Dr. Bharat Pankhania from Exeter Medical School. Boris Johnson